Ladies, if you are preparing for a hysterectomy or have recently had one, then this video is for you. I'm going to be going over the top 5 things to avoid after having a hysterectomy so that you optimize your body for healing. My name is Dr. Brooke Kalisiak, and I'm a pelvic physical therapist who is passionate about helping women optimize their pelvic health. Here at our clinic, we see many women after having a hysterectomy, and they all seem to have some of the same questions. What are safe exercises to do? When can I return to my exercise routine? Is it safe to do insert certain activity? What are my lifting precautions? What do I need to do to make sure that I don't hurt myself? These are all super common questions that we get from women after they have their hysterectomy. And unfortunately, a lot of these women are asking these questions to their doctor and they're not really getting good answers or answers at all. And so today I'm going to show you the top 5 things to avoid after a hysterectomy to make sure that your body heals well. Tip number 1. Do not suck in or pull in your abdominal muscles all the time. This can be a common misconception that we need to always pull in tight through the abdomen, especially if you're watching like at-home Pilates videos or core strengthening videos. It seems like that's the right thing to do. But when we put that constant pull in, pressure in on the abdominal area, that actually can put downward pressure and force through the healing pelvic floor area, and this can be problematic. Instead, what you can do early on is do what we call core connection breathing. And this is a nice, easy, relaxed breathing technique where we inhale and we let everything relax and let go. And as you exhale, you think about drawing in the belly and drawing in the pelvic floor muscles so that we get this nice inhale and relax of the tissues and exhale and contract of the tissues. And this is a better way to get the deep core muscles reactivated after surgery when we coordinate it with our breath instead of holding tight through the abdominal area for the entirety of the day. Tip number 2, skip the planks and the crunches for now. I'm a fan of all exercises potentially being good exercises for our body, but in the early post-op recovery days and weeks, planks and crunches are going to put a large amount of stress and strain through the abdominal wall and the pelvic floor. And this is where we're going to have incisions from the hysterectomy, and we need to protect that tissue in early on healing. So instead, to start reactivating those core muscles, we want to do gentler core exercises in these early time frames. This can be engaging the core with our breath, like I just talked about previously. It can be pulling in through those abdominal muscles and doing a nice march of the legs or a leg lift one at a time. Maybe even doing a modified like side plank, because when we plank on our side, there's less stress and strain through the abdominal wall and the pelvic floor. But in all of these scenarios, we want to make sure that in those early weeks of healing, we want to minimize some of the stress and strain and then slowly and gradually increase the load on the tissue as we get weeks further out from the hysterectomy. Tip number 3, avoid heavy lifting, at least in these early phases. So a lot of people think heavy lifting, okay, I won't be going to the gym to work out. But think about things that might be heavy around the house that you lift. So this might be limiting your lifting of toddlers or kiddos, heavy laundry bins, loading up your arms with groceries from the grocery store. We want to keep weightlifting to a minimum, and that includes functional weightlifting with your day-to-day activities. So we need to plan accordingly for that. Again, we had major surgery and the tissues need to heal and recover from this and have time to build up some of their strength. So even once the doctor clears you for lifting, this is not a time to jump back into heavy lifting right off the bat. We instead want to increase the load gradually. So we recommend starting with body weight activities. And then if that feels okay for a week or so, go up to adding 5 to 10 pounds of weight and then gradually increasing the weight from there. Do not jump right back into lifting heavy loads because that can increase the risk of developing prolapse or pelvic floor dysfunction symptoms after a hysterectomy. Tip number 4, hold off on running. This is not the time to lace up your running shoes. Running puts a lot of impact down through our pelvic floor muscles, and the pelvic area is simply not equipped in these early post-operative days to handle that kind of load. This is another situation where you want to think about gradually returning to activity. And so early on, walking is your best friend. Even if you're uncomfortable, just starting to walk around your house at first, and then increasing to walking up and down your block, maybe even start with up and down your driveway, and then add to up and down your block, and then around your block. You can, if you have a treadmill, you can, as you feel more comfortable with it, increase to walking at an incline. You can increase your speed with walking. But if you can't comfortably get up and down from a chair, or comfortably walk, or comfortably jump a little bit, you should definitely not be running at this point in time. So especially people who are used to running as a form of activity, they can be very anxious to getting back to this, but this is one of those activities that you want to, again, return to gradually, starting with a walk, and then over several weeks, increase that distance and time to a run. Tip number 5, this is not a time for heavy weighted squats. Okay, when we squat, that stretches and opens up the pelvic outlet, which can put extra stress and strain down through the pelvic floor tissues, which again just had surgery performed, and they may not be ready to accept that type of stress, strain, and load. So in order to protect that tissue, we want to minimize the load in these early healing days. So that means limiting yourself to a body weight squat. And in the early days, it might just feel like a lot of work just to do sit to stand out of a chair, or trying to lower yourself slowly to a chair and back up. Then a couple weeks out, you can start adding in body weight squats and see how you're doing. Then you can load with a little bit of weight once you get cleared by the doctor to add in more exercise. But this is not a situation where once you get cleared, you want to get back to like a barbell squat with lots of weight on it. We want to gradually return to that over time. I hope you're starting to sense a theme with this gradual return to exercise after having a hysterectomy, so that you optimize your body for recovery. And what I want to advocate for is that you partner with someone like a pelvic physical therapist to help you plan out a return to activity strategy after the surgery. We are experts in what is going on in the musculoskeletal system, especially in and around the abdominal and pelvic floor area. And so we can assess those tissues ahead of the surgery to know what our baseline is. And then we love to get our patients who have had a hysterectomy back in at the 4 to 6 week mark after surgery to reassess what the pelvic floor muscles are doing, what the abdominal muscles are doing, what your strength level is at now, so that you can gradually build up to where you want to be. Because you can go back to lifting weights, running, doing long distance exercises, anything that you kind of want exercise-wise, but we just need to build a proper program so that your body can do that without the potential of developing pelvic floor dysfunction or subsequent prolapse issues. So I highly recommend, as kind of the bonus tip to optimizing your recovery for a hysterectomy, is to partner with a pelvic physical therapist to make sure your body gradually returns to the strength and endurance level that it needs to be at to do the activities that you want to be doing. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.